And we are live now. Welcome everybody. And it's a great pleasure to be here for the day 6 of Europe-India Digital Health Week. This is the final session of an intensive week-long collection of events and workshops and knowledge cafes that we had throughout these last days. And today we are wrapping up our Digital Health Week with this wrap-up session. So this is going to be an interactive session for everybody to take part and participate. But we are going to start with a keynote opening by Dr. Cátia Sousa Pinto from SPMS. SPMS is the digital strong arm of the Ministry of Healthcare in Portugal. And our country is a country that is having an active role in shaping the creation of the European health data spaces. And Cátia Sousa Pinto herself has been participating in many international forums, like the G20 Forum on Digital Health in Brazil recently. And she's an active contributor to the European health data space from the perspective of a member state, Portugal, which is a country very active in the creation of this Europe-wide initiative. Cátia, thank you so much for being here with us today. Perhaps you would like to add something to your introduction, but the floor is all yours now.
Okay. Thank you, Paulo, for inviting me. I can briefly introduce myself. I would like to share some slides. Is that okay?
That's perfect. Yes, please.
Okay. So I will just start sharing my screen. Let me know if you can see it.
It's visible, yes.
Okay. Let me just put it on presentation mode. Okay. So thank you so much once again, Paulo, for your introduction.
We are not seeing on presentation mode, Cátia. If you want to make it on presentation.
Yes, I put it already. Perhaps it's a little bit delayed. It should be on presentation mode now.
Unless you have dual screens, and then perhaps you're sharing the PowerPoint screen and not the presentation mode.
I'm not sure. You are still not able to see it in presentation mode?
We see the slide, but it's okay if you...
No, let me just try again. What about now?
Yes, now we get the full screen on presentation.
Oh, great. Great. It's better like this.
Yes.
So just a brief introduction. As I was saying, my name is Cátia Pinto. I'm the head for Global Digital Health and International Affairs at SPMS. I'm also the coordinator for My Health at EU services that are connecting today several countries across the EU, and that most of you are for sure familiarized with. So for today's session, I tried to bring here, and let's make it very informal, I tried to bring here a short introduction of how we are currently managing digital health in Portugal, and how and bring a little bit of the example of the building up of the current regulation of the European health data space that is that has already been approved by the Council and the Parliament, and so share with other parts of the world this really good example that it's coming from Europe, that it's taking shape in Europe, and that can also support and be a kickstart for a desired digital future for global health and for a global public infrastructure to support data sharing cross-border and globally. So the shared services in the Ministry of Health is the Portuguese National e-Health Agency. It was created more or less 14 years ago, and in my personal opinion, this was a major step into building a digital future for healthcare in Portugal. It was when we started to harmonize the ICT solutions across the NHS and to provide a roadmap for digital health within the Portuguese healthcare. So we are NHS, we act as the NHS ICT provider and also the national authority for cross-border e-health policy and technical cooperation. So SPMS is responsible for managing all ICT solutions, or pretty much all ICT solutions that are now available in the Portuguese NHS, and some of them are also used or need to be used by the private sector. So having this national governance for digital health supported Portugal into collaborating across the EU and with the European Commission to build up the European health data space. I am actually very happy to share today that the first ever workshop that was held between member states and the Commission to discuss what would become the European health data space was held in Lisbon at SPMS, where we first were discussing how this space for health data could be built and what were the main challenges that member states were facing. So it's really nice to see today. It was actually my first job when I came to SPMS, so it's really nice to look back and see that this effort went forward, and it went forward much quicker than probably any of us would imagine. So I think this is also very significant for other parts of the globe where these initiatives might be arising in different scales and at different levels, that they are probably easier to achieve when we really think wisely about the right governance, because data sharing, the main pillar for data sharing, it's really good governance, a good governance model. And so this governance model was actually what the European Health Data Space regulation was intended to do, to build up a framework providing a legal background for data sharing across the EU, with the main focus of putting people in the center of health data sharing and really making data portability, health data portability, a reality. So to do this, all needs were identified. What do we need to make sure that whenever a citizen across the EU leaves a healthcare institution, he already has his personal health data in his cell phone or in his personal health record. And everything that needed to be tackled was identified. And that's when this space for data, that's a full set of rules, obligations, and duties for European member states was built. Of course, additionally, this regulation also intended to foster a single market for digital services and products across the EU, and of course, harmonize this market with European values. It was also intended to, or supported by, a framework for specific guidance on interoperability at the cross-border level. And so this would ensure the adequate interoperability, not only at the technical level, but at the legal and the governance and regulatory level, so that member states would be able to share data across border in a seamless way. This effort, or this regulation that was then made public in 2022 and it's now been approved, was not built in a vacuum, let's say, or without any previous experience. The My Health at EU infrastructure, that it's one of the pillars of the European health data space, started to be built up in 2011. So long ago, or long before the regulation took shape. Member states across the EU were already participating in different European projects that supported the development of several pilots to identify and to build up the technical interoperability and semantic interoperability needed for data sharing across the border. And then in 2019, this European electronic health record exchange format took shape in the form of a European Commission recommendation for member states. But this, of course, was built during the pilot phase of the establishment of My Health at EU. And then later on, this recommendation for a specific technical format for sharing of health data was widened and took the shape of a regulation for a European health data space. And now the regulation, as we were discussing, it's already approved by the Council and the Parliament and is expected to enter into force in 2026. The component for primary use of data that it's called My Health at EU, it's expected to enter into force in 2028. And secondary use of data, or the infrastructure for secondary use of data, it's planned in the regulation to enter into force in 2030. So this is the overview for the European efforts on cross-border data sharing, but they also need to be aligned at the global level. What is really relevant for patients regarding the European health data space regulation is that it established that whenever health data is in electronic format, all electronic health record vendors, all healthcare institutions, either private or public, need to make or must make all this data available for citizens, namely patient summaries, electronic prescriptions, electronic dispensations, medical image and image reports, laboratory results, and hospital discharge reports. So these priority categories of health data will be mandatory to become interoperable with European health data space, let's say, and made available for citizens and healthcare professionals independently of where the data was first collected. And then a very relevant component of the European health data space is the establishment of an infrastructure called Health Data at EU for secondary use of data. So we added not to the already existing infrastructure for primary use of data called My Health at EU. This regulation brings up a second infrastructure for secondary use of data. And this infrastructure is intended to be a single point of entry for data requests for research, for public health surveillance, for all secondary uses needed to support healthcare and AI development, for example. And so electronic health data must also be made available by health data holders for secondary use when this regulation comes into force. And the data foreseen in the regulation is really wide and relevant for all research and secondary use purposes. We are talking about electronic health data from EHRs, data on factors impacting health, pathogen data, healthcare-related administrative data, genetic data, automatically generated personal health data, data on professional status, data on public health registries, data from clinical trials, data from research cohorts. So a wide myriad of data. It's really planned to be available or to be made available through health data, the future infrastructure for secondary use of data called Health Data at EU. Regarding My Health at EU, and moving again to the primary use of data. I will just briefly describe the work done by Portugal in preparation actually for the European health data space. So we were one of the pioneer countries in having available the 4 services that are now available or existing in My Health at You. That's the patient summary and e-prescriptions. We started already in 2020 with My Health at You infrastructure live in Portugal, and now Portugal is one of the countries that already is able to share data with the highest number of other EU countries, and we are currently able to share data with 11 EU countries. And according to the regulation, it is planned then that in 2026, the EU will be able to exchange data between all EU countries. So regarding our national framework for digital health, and what have we been working on since we first started taking digital health as a matter of its own right within healthcare systems? Portugal today has a national health service portal or multi-channel digital service that it's available for all Portuguese citizens 24 hours a day, all days of the year. And this multi-channel digital service, it's composed by a mobile application, a phone support and counseling done by healthcare professionals that's available 24 hours. We have physical counters to support the more vulnerable population and make sure that digital health needs no one behind. And these physical counters are located in municipalities and local administration, so that citizens that are not able to access digital services by their own can use these physical counters to have support. And we have also an online portal. So we have a digital door or a digital national health service that already coexists with the physical and traditional national health service made by hospitals and primary care centers. We are also developing telemedicine, and this is one of the upcoming services at the cross-border level. And telemedicine, it was greatly improved also in Portugal following COVID-19, and this is intended to improve patient access, especially in remote areas, to specialist care and to healthcare services, to provide medical consultations remotely, and to streamline several administrative processes that were being really demanding on the NHS that can be well done on a digital, using a digital format. We have also several other initiatives like electronic prescription that it's now almost 100% available in Portugal, and we are also part of an open data initiative to reinforce this commitment of the NHS to rigor and transparency of the information. And so we have an online portal where citizens, health professionals can access different domains of health information in an open data format and and have access to different health indicators of performance of the National Health Service. We are also collaborating in 17 different European projects at the moment, and they were selected according to the national needs and to the relevance of the different actions that we need to take in order to build European health data space. I won't go in detail for each one of them, but they relate to building up a European gateway, to build up data quality requirements, to extend European health record exchange format, to have an European digital identity, So all of them are related to the different streams and dimensions of the European health data space. And it's a very relevant, they are very relevant initiatives that actually are a very good way of supporting the cooperation between the member states at the EU level. And on a global basis, we also consider that global health is really national health, and that we need to be in the digital era, that Portugal needs to be connected at the wider level and be able to access benchmark initiatives that are shared across governments in different forums at the international level, so that we are wise procurers in the ICT market, and that we know what the evidence is about the impact of different digital health interventions. And so we are collaborating widely with several different initiatives. One of them, really relevant one, is organization. It's the Global Digital Health Partnership that most of you know. And outside the EU, I think it's really the most relevant organization that has been providing us with support to look at other examples across the globe beyond the EU. And that's all from my side, Paulo. I remain open to additional discussions and questions. And I hope it could be useful to wrap up the series of sessions that you've been having on digital health.
Thank you so much. I would now pass the floor to our co-chair, Dr. Rajendra Gupta. Maybe some comments will be useful at this stage.
Thanks, Paul. Thanks, Cátia. This is wonderful. I must say that what you showed us, it's not only relevant for Portugal, for all over the world. As pioneers, I think you have demonstrated leadership, which is the toughest, because pioneers have no precedent. You have to start, you have to build. So the toughest job is of pioneers. And what Paul does through Health Data Forum, which has emerged as a very influential forum in the world, is to bring people like you to inspire others. By way of background, I was advisor to the Health Minister of India and initiated the Digital Health Mission. In the years that you were setting up the global digital health partnerships, I served as advisor to Minister between 2016 and 18, launched the National Digital Health Mission. So I think this is wonderful. And Paul, we should actually share this particular talk to the wider audience, of what Portugal has achieved under her leadership. And also perhaps exchange, like in India, we are now touching 670 million electronic health records. Our national telemedicine platform has crossed 240 million consultations. But I always keep telling our bureaucracy that this is not good enough. We still have to do more. We have to learn. And I think this particular session was a great insightful learning, for all of us, that what are the various components. I think as a collaborative forum, we could learn from each other and develop joint best practices. I would still think that, we should, Paul, look at interviewing, a couple of people, create a best practices session that can be sent across to various people. We are working with WHO on creating the roadmap. So maybe something that we could do together. And these are large scale deployments. So I'm sure they would have their own learnings. They would have come through challenges and they would have addressed them successfully. But as digital health evolves, there are more facets that are coming. I think what happened in the last 3 years, you look at last 3 months was more insightful with generative AI becoming multimodal AI. And I think everything is going to get impacting our health system. So I look forward to more such interactions and collaborate, Cátia, with you on how we can take those to LMICs, which needs digital health the most, and which is a huge chunk of human population. So thank you so much.
Thank you so much. And I will open the floor now to our other guests in the room. Perhaps Bledin Rees or Lisbeth Siderius would like to comment on this very inspiring presentation. You are muted if you want to speak, Lisbeth or Bledin. Bledin is taking the floor now.
Good morning. Cátia, Thank you very much. And I echo what Reginda was just saying. What Portugal has done is very impressive indeed. And I know from having had conversations with SPMS over the last couple of years at some of our round tables, the progress is very impressive. So thank you for all you are doing.
Thanks, Bledin, for the acknowledgement. Lisbeth, over to you.
Well, thank you, Cátia. Very nice overview of what has been done. I recognize some of the issues also in Netherlands. Of course, every country is doing this a bit on its own way, and it's the difficulty is how to get them moving all the same direction. So I had some questions because it's not so specifically nowhere so specifically written on how to exchange the data. For example, which interoperable data do we use? I saw SNOMED, but I did not see LOINC, for example, which is very useful for pediatricians because it's numerical. I also do not see anything on disabled people. It should be codings to include them should be included. And so in the primary use, I think it should be more enriched with more data, more specific data, which are most of the time sometimes are already in place in some countries. Maybe not in Portugal, but for example, the ICF for disabilities is in place in Croatia for different reasons, but it is there. So to work as a pediatrician, I try to collaborate with my colleagues in different countries. In Lithuania, there is nothing yet. For example, they have things, but not interoperable with, for example, other European countries. So for us as pediatricians and patient organizations, we need to have some guideline what we will all follow to make it happen, actually happen, to implement it. So, for example, I'm with HL7, I follow them. So in HL7 Netherlands, I can contribute there, but I'm now looking at other pediatricians who maybe collaborate. So if we really want to make it happen, also clinicians should be involved and they should understand. And that is at this point completely lacking. If you start talking about digital health, pediatricians say maybe 10% knows something. And if we are not involved, it's not going to be harmonized. It's not going to be harmonized.
Okay, thank you so much for these observations, Lisbeth. Cátia, maybe you'd like to comment?
Yes, I completely agree with what Lisbeth was saying. I would have two comments. The first is that the guidelines or the standards to be used in order to make cross-border sharing of health data a reality are going to be put forward in a public way by the European Commission in implementing acts. The European Health Data Space Regulation has this planned, so it will be clear for everyone what needs to be in place regarding interoperability and cybersecurity requirements for the different EHR systems to be compliant with the EHDS regulation. And so I think this will bring more clarity into the public eye because the work has been evolving, but of course in a closed forum of voluntary countries and agencies, but it in the public eye as it starts to function in a regulated way under the umbrella of European regulation, that's the European Health Data Space, and with implementing acts made public by the Commission. On a second note is the fact that we need to identify, after this first step is done and cross-border data sharing is a reality across all EU member states, or actually at the same time, we need to identify areas specific areas like rare diseases, for example, where cross-border sharing of health data has added value, and what we need to accommodate in the current patient summary, for example, to make sure that it is relevant for people with specific conditions that may greatly benefit of an enhanced cross-border sharing of health data, because they need to be to access care outside of their usual country or of their country of origin. And so in this point, I totally agree that we need to look at cross-border data sharing more specifically now that we have it established in general, let's say, and the technological pillars are there, the governance model is there. We need to start looking to specific health domains where cross-border sharing of health data is more useful. And the third note is about workforce capacity and training. This has really become a topic in, I think, all forums that I've been attending in the last weeks, and they are several, because you know that June it's a month with several conferences and discussions at the cross-border level. But workforce training and health professionals training on digital health has become really a very relevant topic. And why we have been saying this in different international conferences and national conferences, the fact is, when we look to medical college, to health-related universities, there is not that much investment in training health professionals for the future of a digital healthcare. And so raise awareness towards the need of having health professionals that are trained for the future of healthcare, that it's, of course, digital. It's a fundamental cornerstone to implement any digital health strategy, being it at the national level, but also at the international level. So I also agree with Lisbeth on this topic. We need to start to raise awareness regarding the health workforce and their role in implementing digital health strategies and building the next generation of healthcare services that will have a strong digital and AI base.
Fantastic. Bladin and Lisbeth, I'm not sure who was first. Bladin.
Thanks, Paul. I just two points following on from that exchange, really. In relation to implementation of EHDS, I think all of us who want to see it be as successful as possible recognize that the key to that is now going to be implementation, but not just by the Commission, but by member states. So the challenge for all of us involved in digital health over the next couple of years is to help both member states and the European Commission to implement and exercise those powers in the best possible way. So I think there's a lot of work to be done by all sorts of different organizations, patient organizations, healthcare professional bodies, NGOs, to help inform some of the ways in which those powers are exercised. And then I think the other thing, listening to some of Cátia's last points, was that the training of healthcare professionals is clearly critical. But I think for the wider benefits of digital health to be realized, we need a significant investment in health literacy for all citizens. And unless that's of equal importance to, let's say, the training of healthcare professionals, the benefits are not going to be realized in anything like the levels that they could be. So this whole thing of health literacy and digital literacy are central to digital health not leaving anyone behind, but also realizing these substantial benefits. So that's what I would like to emphasize, really. Thank you.
Thank you so much. And before Lisbeth passing the floor, let me make just 2 acknowledgements here, because Dr. Rajendra Gupta has to leave us in a few minutes, and we have a new co-chair joining us, Henrique Martins. Welcome, Henrique. And Rajendra, maybe you'd like to say a farewell note before you depart, and then we'll welcome Henrique Martins, and of course, the floor to Lisbeth, as she has requested for that. Apologize for this, Lisbeth. Rajendra, over to you.
Thanks, Paul. Thanks, our friend Gladden Rees, Elizabeth, for the wonderful, thought leadership in digital health. I think we all need that. Very important point, Elizabeth. You always go back to basics, which is I think we all have to go to if we really want to advance technology in healthcare. And I'm very impressed with what Paul has done as a forum to get all these leaders together, getting Cátia to speak with us, to share her insights. During the very start of this week, we had launched Data First AI Letter as a campaign. I think Elizabeth raised that today. So we need to get clean data, and we have to move from that old paradigm that we always talk about, that data is new oil. I would say data is water, keep it clean, keep it portable, so that all of us can use data for health and not jungle around with, corrupted or incomplete data. So this forum over the last 1 week has accomplished a lot. I think hats off to all the leaders who joined hands with our phenomenal Paul. We have a couple of initiatives coming, which I'm sure that Health Data Forum will steer. We have partners like Global Health Connector, and I commit to my support in terms of resources to drive for digital health. Thank you so much, Paul. It's been a wonderful platform to be a part of, to see the change that we can impact on ground, and for getting almost all the people whom we need, including the head of data at WHO, Steve McFeely, who has agreed to support these initiatives. So look forward to more, and hopefully see some of you in Mumbai when we host the Global Digital Health Summit on 4th and 5th October. Thank you so much.
Thank you, Rajendra. A round of applause, I gave for this income, and thank you so much. And now over to you, Lisbeth. And I think Henrique, if you are online.
Yeah, just welcome, and congratulations for this work. It's been good days. Yesterday we had a very nice discussion. I'll be here for the discussion part, the wrap-up part later on. Now I want to listen in.
Fantastic. Thank you so much, Henrique, and welcome. So Lisbeth, maybe a final comment, because we released Cátia from her duty here as a keynote.
Yeah, the comment is on the rare diseases, because I think they should not consider it as special group, because in pediatrics, almost every child with a chronic disease has a rare, will turn out to have a rare condition. So all the diagnostic tools, everything is also applicable for rare diseases. It should not be separated. And in that sense, I think in primary use, it's also necessary to have the pathogenic data and the genetic data in primary use. And I did not see that. Because the genetic data are the most important key for diagnosis and follow-up for the patients too. That's just comment.
Yes, thank you, Lisbeth. But just to clarify, when I was saying specific, it was not special. It's really the specific needs of the different conditions and of the different reasons that support health data sharing at the cross-border level for primary use. So we have a general patient summary, but then we need to address what other sections we need to add to the general patient summary to support the specific needs of certain cross-border healthcare provisions that are happening across the EU, and then can be greatly enhanced by a patient summary with health information that fits their needs. This is one point. The second point is to say that the minimum data categories that are planned in the European health data space for primary use are minimum data categories. They are not fixed. They are to be updated and widened through European Commission implementing acts. So while we stayed for a more conservative approach to the mandatory fields that need to be in place at the cross-border level for the initial implementation of the European Health Data Space, we will, of course, move forward into widen the scope of health data domains that are to be made available at the cross-border level. But it was intended to be conservative at the beginning to really make it implementable, having in mind the different maturity levels of different member states across the EU.
Just one remark, I think it is unethical to not have the genetic data in primary use and have them in secondary use. I think the patients should have their data also and should not be used for secondary use unless it's also for primary use.
Okay, point noted, Elizabeth. Thank you so much. I have another raised hand for Dr. Prasant before releasing Cátia to leave. Dr. Prasant.
Yeah, I'd like to congratulate Cátia because it was a wonderful presentation and a great, innovative transformational work in digital healthcare in Portuguese. Two things, as Cátia has told, cross-border consultation of specialists in healthcare providing will help a great indeed. And also training for paramedics as well as for healthcare professionals by digital tele-class sessions will definitely raise the standards of policy for training. And another highlight on mental health digital counseling sessions, which will also help a great deal in the ecosystem. Thank you.
Cátia, any comments?
Yeah, thank you. Thank you for the comment. And I think that there are really different topics that need to be addressed at the cross-border level. The main point, in my perception, to start with is to say that we will have a legal framework and a governance model for cross-border data sharing, health data sharing. This is the first time in public health history that we really have a governance model for data sharing, either for primary use or for secondary use that is legally binding. All the possible uses that will be made of this public infrastructure that is being built between member states are then to be defined and updated as long as the digital maturity of health institutions and different member states allows for more and more comprehensive data sharing cross borders. And of course, as more comprehensive the data sharing across the border is, more possible use cases, more possible uses will be available to improve the way we are defining today global health and working at the global health level. So this is what I would like to underline from our discussion today. But still, having said this, I think we now really need to start discussing what is needed to make the most out of this upcoming regulation. Now we do not need to discuss the regulation. We do not need to discuss the need for a regulation. That was what we were discussing before the regulation was out. We need really to start discussing what will we do with this regulation, because the data space, the health data space, national or European in itself, will not improve health if we do not use it wisely in all member states.
Fantastic. That's we are wrapping up and reaching out to the close. Maybe opportunity for Henrique Martins, our co-chair, to say a few words because I'm sure it must be feel so proud of the work SPMS is achieving and the role Portugal is taking in the European health data space architecture. Enrique, would you like to express some words as we wrap up the session, the opening session?
Sorry. Yeah, I'm here. Yeah, I think Cátia made. I mean, I didn't hear all the presentation. I'm following a good work. I think it's good for everyone to understand the struggle between national level, local level, and European level. And I think often people do not realize, even for Portugal, that has more than 600 staff dedicated to the national level, which is an amazing number for the size of the country. And it's even increased now with more resources through the Resilience Fund. It's very difficult for countries to struggle between legacy systems and all these innovative approaches that academia is bringing on the table, large companies are bringing on the table. So sometimes people don't realize how much of a struggle it is to balance what I call public or for the public digital health and the things you can do in a very small niche, high expense digital services that only a few humans can afford. So yes, of course, you can have a top designed, super AI based electronic health record, perhaps already or in 1 or 2 years. But the thing is to offer a cheap or affordable solution to all public hospitals, not just in Europe, but even around the world, and to primary care, as we've done in Portugal, took us years because we had a legacy of publicly designed systems. I'm not anything against commercial systems. I'm just trying to say that when we look at equity, and I've heard that we're discussing today about equity and access and literacy, it's very rare to find a country where private companies have educated the people on digital skills. So these activities fall under the budget of the public, and that strains it even more what we have to do. So yeah, definitely. And on the other hand, the regulation system also tends to be sort of public driven. Now, what I want to say on this and to finish is to stimulate discussion is that perhaps it doesn't have to be this way. Perhaps we can evolve our mechanisms to have more hybrid sharing of both regulatory responsibilities as well as educational responsibilities. So things that traditionally in Europe we associate with the government role, they may not necessarily be funded 100% from the public budget just because they are public goods. So the idea of a public good and a sort of an AI, data-ready, AI-ready ecosystem is a public good, but it benefits both public and private. So it should be designed and it should be sustained and in a way funded by both mechanisms. The traditional way is we use tax, we get the money, and we use that money to provide public services, in this case, education or regulation. The problem with this model for the digital health is that many of our companies, they are not EU funded, they are not EU based. So they might be large international companies. And until we find a model to tax that type of revenue, perhaps we need to co-share funding and co-share efforts on regulatory spaces. So I just wanted to open people's brain to this concept, is that if we have the principles right, and then we don't take a very classic approach that these are the principles and now here's the government has to make sure everything follows these principles, rather than put the responsibility to government and of course national agencies like SPMS and many others, NICTs and others around Europe and around the world, we then need to talk about co-sharing of regulatory and educational responsibilities. Because for me, these are the two big challenges in the coming 10 years in the European health data space implementation. It's not the infrastructure or the standards, those things, like Cátia said, they will progressively incorporate more data sets, which will make happier more stakeholders. It is actually how do we educate, as I normally say in the expand initiatives, which are promoting, it's a project promoting the exchange format. We have to educate 340,000 million people, because everyone is related to the European exchange format and the European health data space. Now, if this falls under 27 people from 27 governments and maybe 1 or 2 people from their regional agencies, then it's too few people, it's too much responsibility. So this is just a few ideas, and really acknowledge the work. So it's my of course my opportunity as a co-chair of coming from Portugal to say that, you know, SPMS is definitely you know, as a lighthouse, and it has been kept like that. And Cátia is part of that light. So actually, you look at her hair, and it's quite light as well. So it's good. But anyway, I wanted to highlight that job and that function. But I also want to say that we now have new agencies on the map that did not used to be there. We have very active countries like Cyprus, which 10 years ago, just giving you an example, 10 years ago, I was asked to visit Cyprus on a troika. No one remembers the word troika now, but we, Portugal, Cyprus, Greece, we really know what the word means. And I was invited to go to Cyprus on a troika mission to start the first ever IT national system. And now, not more than 10 years later, Cyprus is leading our joint action and doing important job, which also means, and I'm now here from Romania today, that even countries that are lagging behind with large populations, not the case of Cyprus, but in any case, they will bring innovation to the table. So that's another thing about equity, is the way we treat countries in Europe has been the same, regardless of their level of maturity, which also gives an opportunity to their citizens to benefit from similarly mature digital services. And that's another difference. I don't know if it's a difference with India. That's something we will learn. I will be there in October, eager to learn. But it's definitely one of the biggest challenges in the US, is how the different states offer the same thing to the same Americans. And this is, for us in Europe, a big value. And we should strive for that.
Mm-hmm. Thank you so much, Eric. Thank you so much. Maybe Dr. Prasant from India can bring us some perspective on these challenges. It's Europe-India Digital Health Initiative, and voices from India are welcome. If not, then I'll pass the floor to Sophia, because maybe she would like to, and obviously to thank Cátia Sousa Pinto for this wonderful presentation. But Cátia, before you go, maybe you hear the announcement from Sophia. Sophia, maybe announcing our upcoming events, where we also hope SPMS to join us.
So good morning all. We are at Health Data Forum. We are strong at work for our November event. We are holding an event in Lisbon called Real World Evidence for the Real World. And we are going to work on very specific themes on health data and how to handle them related both to public health and the industries, so that the data can be put to work and how we can do that. We have a very strong panel of speakers coming to Lisbon to be with us from the 14th to the 16th of November. And I really hope that we can count on all of you with us here in Lisbon.
Thank you so much. Cátia, thank you so much for joining us on this opening keynote for the session. We are now going to take a short break as I stop the live transmission for our viewers that are following us. Thank you so much, dear viewers. And this session is going to be replayed next week to a much wider number of audience. Thank you so much. And I'm now going to close the live transmission, and we'll keep here on the Zoom for coffee and some notes among ourselves. Thank you so much, dear viewers. It's great to have you here.